Hello friends, I'm Dashprit Kaur, Chief Physical Therapist, Bihar Neuro Diagnostic Center, Patna. Today I'm here to give you some physiotherapy sessions at home. So I know since we are all fighting a pandemic and there have been difficulties in reaching out to your physical therapist for regular sessions, but definitely that should not deter us from doing certain exercises which are quite useful to us. So before we proceed further, I would like to congratulate Multiple Sclerosis Society of India, for which I am a life member since 2008. And recently they have completed their 35 years. And so why this video? So while we were just sharing greetings with one of the most persuasive, or I'll say one of the most dynamic personality of MSS and Mrs. Sheila Chitnis, we just came up with an idea like now there have been floods, there is a COVID fear, and a lot of problems are there for patients to reach out for their therapy session. So why don't we make a series of videos, something which is really comprehensive and easy for patients to follow, and which will help them to take care till they reach out to their therapist. So kindly take this as a general guide, and before you take up any exercise program, it is very, very necessary you consult your therapist for its do's and don'ts, or whether it is being recommended for you or not. Okay, so here's the first series that we're going to begin with. In this, we are going to discuss about clamshell exercise. So as you can see in this figure, it's pretty easy exercise. You have to just lie down straight onto your side and lift your leg up, as simple as that. All right, so let's see, why should you do clamp exercises? In my opinion, this is one of the most incredible exercises, very simple exercise to begin with, like because it helps to strengthen your glutes, your pelvic, it helps to ease your back tension, and it helps to strengthen your core muscles and low back muscles. So in my experience for over 15 years now, so I feel that if you're able to strengthen group of your muscles which are responsible to maintain your balance and which help you in walking, half of your problem is already sorted out. So this exercise is one of my favorite exercises, and I feel it's quite easy for patients to follow. So yeah, and this exercise has been shown to be one of the best exercises for hip strengthening, and this research paper was published in JAWS PT, one of the very revered journal. And if we say in clamshell exercise, what are the main target muscles? So it helps to strengthen your gluteus medius. Your hip muscles is basically three big muscles, out of which the gluteus medius plays a very important role in stabilizing your pelvis. So this helps to strengthen that, and it helps to balance the muscular effort between your inner thigh and the outer thigh and your pelvic floor. So if I say pelvic floor, what I mean to say, the muscles which lie just under your pelvis, which support your entire lower area, your urinary area, your bowel area, that entire group. It has a hammock kind of muscular muscles. So that area, I call it as pelvic floor. All right. And also this clamshell exercise helps to maintain the balance in the leg and hip muscles. All right. So let's see very minute pointers to help you perform this exercise perfectly. So number one goes, you lie on your side. Number two, your back should be straight. Number three, your neck should be neutral and supported with your lower arm. Number four, bend your knees at 45-degree. Number five, join your feet and get going. Lift the lower leg up. So I guess it's pretty easy to follow. All right. So I know now there is no excuse that you were not able to come to us. We have reached your homes. We are right there. No more excuse. I know you are in the comforts of your house. Get onto your bed or on the floor with a little thin mattress or chadar or dari, anything which is comfortable. Don't just lie on the hard floor. And let's start performing it. All right. No excuse here. There's the BBC exercises, which I call the balance, bladder, and core. This is just the first exercise of that series. And here, no excuses are going to work. Straight away, let's start. All right. So take your positions, everyone. All right. You with me? Okay. Let's begin with our clamshell exercise. So I have divided into various levels. First, take your starting position, back absolutely straight, rest your hand in front of you, tuck in your abdomen, tuck in your pelvic floor muscle, bend your knees to 45 degrees and feet join. All right? Okay. Basic level 1. What you have to do, simply lift your leg up and down. Don't bend back. Make sure your abdomens are tucked in and your pelvic floor is tucked in. Level 2, you can use a Thera loop, a very light resistance. Lift your leg up, but make sure when you lift your leg up, your abs is inside and your pelvic floor muscles are tight. Tight, and you go loose. Up and tight, and then you go loose. Very nice. You've been doing really well. Let's increase some resistance in level 3. Tuck in your pelvic floor muscle, tuck in your abdominals, lift your leg up. Hold, 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 and come down slowly. Contract your pelvic floor muscles, lift your leg up, and come down slowly. And one more time. Up, contract your muscles, come down. Keep holding it, keep holding it. All right, so now let's practice holding the pelvic floor muscles for longer. Come on, hold your pelvic floor muscles. Good. Hold it and come down slowly. Then you go up. You can use regular elastic also. You can increase the number of loops in the elastic to increase the resistance. No need to rush out to the market in this lockdown phase. And just keep doing your exercise. Make sure your leg is aligned well and you can feel the pressure on your inner and outer thigh. Contract your pelvic floor and get down and relax. Good. Let's go to level 4. Lift your hip up the floor or up the bed. Now perform the same exercise. Don't forget to contract your pelvic floor and abdominals. You guys are doing great. You guys are doing really great. Yes, lift your body more up. Come on, this is going to strengthen your upper limb also. Come on. Yes, very good. Now let's add some weight into it. Just elastic or some Thera loops and keep going. Don't forget to contract your pelvic floor and abs and you go down. Fantastic. Now I'm sure you guys have learned this really well and you're not going to wait, you're not going to think, you're going to just do it. And in the beginning, I would say just start with one set of about 10 repetitions, basic level. Once you feel you're doing really well, go for 2 sets of 10 repetitions. Once you feel you have aced that, go for 3 sets of 10 repetitions. That will be for your basic level. And if you feel that, yes, you're able to perform basic level very nicely, keeping a good focus on your breathing, when you lift your leg up, you have to breathe out and you have to contract your abdominals and pelvic floor muscle. Once you bring your leg down, you have to take your breath in. All right. So you perform that going up, you breathe out, going in, down, you breathe in. All right. Perform this. It'll take some time to get this regulated. Once you go up, you breathe out, your pelvic floor in, your abdominals in. Once you come down, then you breathe in and relieve all the muscles. All right. Just perform this. Once you've done with the basic level 1, add level 2 at the end. So in a day, if you're performing 3 sets, 1 set of level 1, second set of level 1, third set of level 2. So this way you can try different permutations and combinations, and I'm sure you'll be doing really well very soon. Thank you so much for listening, and don't forget to subscribe to our channel, Dashpreet Kaur or Bihar Neuro on YouTube, and stay safe, wear your mask, and follow social distancing. Thank you so very much. Keep performing till we meet next time. Bye-bye.